Alright, so I'm going to tell you guys why single-payer healthcare will not work and its disadvantages. So first I'm going to talk about how single-payer healthcare will limit access to care. Like he said, switching to single-payer healthcare would reduce the salary of doctors and physicians compared to a multi-payer system. Reduced salary means less incentive to become a doctor in the future. And not only does shortage limit access to care, it also reduces the rate of medical progress. Fewer talented people coming into the industry decreases the supply of talented medical research. That just kind of makes sense. Another problem in Canada, only half of their ER patients are treated in a timely manner by national and international standards according to a government study. So, because they have single-payer healthcare, their hospitals are overpacked and they can only get to half of the people in their ER in a timely manner. Also, the physician shortage in Canada is so severe that in some towns they hold lotteries with the winners gaining access to the local doctors. Like he mentioned about the waiting lists, the wait times between referral from a general practitioner and elective treatment was an average of 19 weeks in Canada, which is the longest wait time since 1993. So 19 weeks, that's like almost 5 months, I think. That's a long time. Two examples, a woman named Sylvia from Ontario, she had a 40-pound fluid-filled tumor removed from her abdomen by an American surgeon in 2006. Her Michigan doctor estimated that she was within weeks of dying, but she was still on a waiting list for a Canadian specialist. Another man with chronic pain in his legs had a referral to see a neurologist in Canada, where he would most likely be referred to someone else and then put on a waiting list for surgery. They estimated the whole process would take roughly a year. Instead, he went down to the Mayo Clinic in Minnesota, and he had his surgery done, and he paid out of pocket for it. So, same with the woman, they paid out of pocket in America to have their surgery done rather than wait in Canada for free. Another thing, between 2006 and 2008, Ontario sent 160 of their patients to New York and Michigan for emergency neurosurgery. So Canada's supposedly better healthcare system is sending their patients over to America to have their emergency medical procedures. Another thing that single-payer healthcare does is it limits quality of care. Canada's healthcare comes in dead last in a global survey covered by Canada's Maclean's magazine. Limiting the ability of physicians to invest in advanced medical equipment that takes advantage of new technology. So, because to have a single-payer healthcare system, there's a shortage of workers, there's a shortage of funds, so they can't afford to invest in the advanced medical equipment. In a study of more than 20,000 Canadian doctors, 75% say that funding of the healthcare system, a shortage of physicians and other health professionals, paperwork, and bureaucracy are curtailing the amount and level of care they want to provide patients. So in Canada, 75% of this study, these doctors say that they're not happy with the quality and quantity of care that they're providing. How would we fund a single-payer healthcare system? If we followed the Delaware concept of increasing payroll taxes, then this would make it even harder on small businesses to not go bankrupt. I mean, it's already hard enough for the economy. Also, income tax would increase, and that means, since we have the progressive tax bracket, so it increases exponentially for how much you make, that means the upper and middle class would be paying mostly for this health care. Why should Americans have to pay for the health care of people who are irresponsible with their health, like, say, smokers? In the year 1998, a study was done that showed that $72.7 billion were spent on smoking-related medical costs. So that's a ton of money. I don't think that Americans should be paying for other people's irresponsibility. Also, my final point. Canadians are moving away from their single-payer system and actually moving towards a more privatized healthcare system. Angus Reid, a well-respected Canadian pollster, asked Canadians to rate their healthcare system. When he started doing the polling in 1991, a clear majority of Canadians gave the system top marks. However, in the year 2000, when he did the poll again, under 25% gave the system that rating. So over time it decayed, and they weren't happy with their system. Also, Dr. Day, a Canadian orthopedic surgeon, estimates that 50,000 people are seen at private clinics every year in British Columbia. According to the New York Times, a private clinic opens at a rate of about 1 a week across the country. So Canadians are switching towards a more privatized healthcare system.